Hi. Today I would like to talk to you about something unusual, but not so unusual, that happens to children between the age of 1 and 5, 6. They sometimes get a diarrhea. They start having 1, 2, 3, up to 5 or 6 bowel movements in a day. Loose, very loose, sometimes even watery. And you can recognize in the stool little pieces of food that has not been digested, especially vegetables like carrots or greens. And you start worrying about it. You say, well, this child has diarrhea, we have to do something about it, put him on a diet, avoid certain food, see if he has a virus. And whatever you do, it doesn't matter how you change his diet and whatever you do, he keeps on having this diarrhea for days, for weeks. So you have to go to the doctor, you have to see a gastroenterologist for this, see if he has developed at one point or another an allergy or an intolerance to food or some infection. It doesn't matter what you do. You give him antibiotics, you give him various diets. He keeps on having this problem, which seems to be a problem, but he doesn't seem to be sick. This child, or even though he has these 5, 6 bowel movements a day, he seems to be perfectly well. He's energetic, he is hungry, he eats normally. So there is a contradiction between this disease and the non-disease that he seems not to have. So, what is the reason for this particular diarrhea in this age group, up to 6 years of age, or a little bit earlier, 5 years of age? This diarrhea that goes on and becomes chronic. Well, this is what gastroenterologists that have studied it call either chronic non-specific diarrhea or the irritable colon syndrome of childhood or apple juice diarrhea, whatever you call it. It is not a disease. It's just a problem. It's a problem that has an explanation, and I would like you to see the explanation in this animation, in this video that I prepared for you. Look at these two sides of the screen. On the left side you see what happens normally. A bowel movement a day, or 2 bowel movements in a day. The food gets into the stomach, goes into the bowel. The small bowel is digested and absorbed, and then it goes up to the cecum, to the large intestine, to the colon. And when it comes to this, it goes slowly. It goes slowly, so that at the end of the day, there is 1 bowel movement ready, and the child has just 1 or maybe 2 bowel movements, not more. On the other side, on the right side, you can see that the cycle of the large intestine goes much quicker. There is food that arrives from the small intestine, gets into the cecum and goes quickly to the rectum and gets expelled out 3, 4, 5, 6 times a day. Does not have the time to get formed, to become a formed bowel movement. What happens is that there is an increase in the speed of the transit of food in the colon. It is normal in small children that there is this increasing velocity of the stool in the intestine, in the large intestine, in the colon, and it's normal that they have a few bowel movements, up to 6 bowel movements per day. This is not a disease. My teacher, my professor in America, when I was there studying gastroenterologist, Murray Davidson, described this phenomenon, this problem, something that looks like a disease and it's not disease, and he called it the irritable colon syndrome of childhood. What do you do about it? Nothing. You just wait. As it comes, it goes, and it can go up and down and back and forth without causing any problem at all. Let's call it the diarrhea, non-diarrhea, or the non-specific diarrhea. That's it.